My name is Curtis Cost. I'm the author of the book Vaccines Are Dangerous, Warning to the Global Community. It's the updated version of the book which will be coming out in a few weeks, this book here. I came to this rally to give my support because in my book I do discuss the H1N1 issue, and based on the research I've done, I think an argument can be made that it would be safer to be bitten by a rattlesnake than to take this H1N1 vaccine. At least there's a treatment regimen for rattlesnake bite. There is no treatment regimen for whatever happens to you from this H1N1 vaccine. When you're putting ingredients like mercury, squalene, animal cancer cells, and God knows what else, in some kind of crazy witch's brew cocktail, and then you say you want to give this to pregnant women, that's madness, that's insanity. And there should be more people out here, but the thing is, most people don't know. And in the Black Latino community, I will be working very hard over the next few weeks to make them aware of these issues, and I'm planning on organizing a forum later in October on this topic. What the speaker said on stage about there not being a pandemic and not being a crisis, they're absolutely right. And it's easy to verify that there is no crisis because all you got to do is look at these standards set up by the United States government. By the United States government's own standards, there is no crisis, there is no emergency. Now, what is that standard? Well, if you go to the Food and Drug Administration or the CDC or Department of Defense criteria, anything that's any disease that affects less than 200,000 people is considered a rare disease. While with swine flu, you talk about maybe 40,000 people they were saying had it in the U.S. Now they've escalated that number. Worldwide, they said at one point about 100,000. Well, if it's 100,000 worldwide, that's well below the 200,000 mark for rare diseases. Well, now they're saying millions of people have it, but when they're saying that, what most people don't know is those are just estimates. They're not based on actual test results. And in fact, the test results are all bogus because none of the H1N1 tests have been approved by the FDA. They're just putting these bogus tests on the market because they've passed, they declared an emergency. So basically by declaring that there's an emergency, that justifies putting a bogus test on the market. It justifies putting untested, dangerous vaccines on the market, and it's ludicrous. And everybody will be outraged if they just knew the facts, which my book, I try to outline that very clearly. When we look at the money involved in this H1N1 madness, I mean, the U.S. government, last document that I saw, has committed something like $7.9 billion to the purchasing of these vaccines and the related issues regarding H1N1. And worldwide, if you add up all the different countries who are making these orders for these vaccines, billions upon billions upon billions, it's madness. Now, when you look at the facts and statistics published by these medical journals and centers, it doesn't match the hysteria that's being generated. There's just no correlation between the statistics and the facts around the H1N1 and the hysteria. So unless everyone in the federal government of the United States and all the medical institutions, the CDC, the Food and Drug Administration, and all the heads of states and all these other countries purchasing this vaccine, unless they all went stupid at the same time, you know something else is going on. And it's not because there's a new virus. In fact, is not even any evidence that there really is a virus causing this, because this all got started back in March, April in Mexico, and just so happens in the town of Gloria, there was a pig farm that was dumping thousands of tons of pig excrement and other waste products into the waterways, creating extremely unsanitary conditions, creating clouds of flies, and it was there where people started getting sick. So whenever you have unsanitary conditions, that's always the feeding grounds for disease. But the medical establishment is not talking about that. They took a situation where people were getting sick over there, and somehow, magically, they managed to isolate this virus, grow it, and then they managed to conclude that this was the one and only cause of symptoms like sneezing, coughing, fever. There's 1,000 things that can cause a person to sneeze or cough or have fever. How on earth could they possibly have isolated a virus and concluded that this one virus, H1N1, was the cause of all these different symptoms? It's laughable. I've done some research on this process. I know there's no way on earth this can all be done in 1 month. It is madness. And the only reason people are upset more about this because they don't know the basic facts. So the efforts of today and Gary Knoll and hopefully my book will make a contribution toward this. And as I said, I will be working working with the black leadership and out there, Latino leadership, making them aware of these issues because it affects all of us. They start now with the healthcare workers. Soon it's going to be everybody's going to be mandatory. And the scary thing is, I don't think they're going to even need to make it mandatory for most people because most people out there don't know the facts, and they're going to be fighting to get online to get vaccinated for H1N1. And that's the really scary thing about all this, because it's not like this information is locked up in a vault someplace and nobody has access to it. The information is there if you know where to look. I mean, they don't hide it, but in terms of the impression that they give to the general public, it just totally conflicts with the actual statistics and information. So it's the fault of the media and those who control the media for not bringing all of the facts out into the general public and allowing people to function and be afraid based on impressions. For example, the president had an scientific advisory panel put together a report with regards to H1N1. Now, in that report, if you actually read it, they throw out these big numbers. I mean, 90,000 Americans are going to die between September, October. I mean, half or 3/4 of Americans are going to come down with H1N1. I mean, they put out all these scary statistics, and then when you read the fine print, you find out that they say, well, these are not predictions, these are possible scenarios. But wait, once you put these numbers out, people are going to live in fear unless you really fully clarify that you're not making a prediction of these big numbers. So there's a lot of misinformation that's deliberate, and whatever the real agenda behind this is, I mean, we know money is definitely a part of it. There may be other agendas involved as well, but people need to get informed. We need to get the ministers involved in this. We need to get our politicians involved in this. Everybody needs to be aware of both sides of this argument and then get the information out to the people on the grassroots level, because they're all going to be affected.